We begin tonight with the country's first confirmed case of the 2019 novel coronavirus. The patient is a 38-year-old woman from Wuhan, China, who so far appears to be in stable condition. While the health department says it is on top of the situation, some Filipinos ended up panic buying masks in Bambang, Manila. Ria Fernandez with the story.
The health department confirms the first 2019 nCoV case in the Philippines. A 38-year-old woman from Wuhan who arrived in Manila via Hong Kong last January 21. But it was only 4 days later after arriving when the patient experienced mild cough and sought medical help. Her swab samples were sent to Australia for confirmation. Results came Thursday and she turned out positive for the virus. DOH Secretary Francisco Duque notes that the patient is asymptomatic. This means she does not display any symptoms. The patient is currently under quarantine at the San Lazaro Hospital in Manila. Authorities are now tracing individuals who may have had encounter with the patient during her stay in the country.
And we are looking at the places where they'd been to in Cebu and in Dumaguete.
Duque says he is now recommending the temporary restriction of travelers from the Hubei province, where Wuhan City, the epicenter of the disease, is located. Duque earlier rejected the idea of banning Chinese tourists in the country, fearing that it could sour diplomatic relations with China. He allays the public's growing fears about the virus.
I assure that the public that the DOH is on top of this evolving situation.
As it stands, 27 other patients under investigation are still being monitored, including 5 who were discharged. But Filipinos are not taking any chances. Hundreds flocked to Bambang in Manila and formed long queues that reached even the sidewalks, all wanting to secure face masks. The country representative of the World Health Organization, meanwhile, warns against comparing the situation to the severe acute respiratory syndrome, or SARS, amid reports that the nCoV infection rate is already nearing that of SARS.
So we have to look at it in that context and not purely compare numbers, right? We are talking 17 years later, enhanced.
For the meantime, Duque urges the public to take precautionary measures such as wearing face masks, staying hydrated, eating nutritious food, and washing hands thoroughly. For News 5, Ria Fernandez, We Are One News.
The death toll from the 2019 nCoV outbreak in China has climbed to 170. China's National Health Commission says almost all of the deaths are recorded in the province of Hubei, whose capital Wuhan City is believed to be the origin of the virus. Officials also reported that the number of those infected rose to nearly 8,000 on Thursday. Russia, which has not confirmed any case yet, announced it will shut its border with China. The Russian Foreign Ministry also advised its citizens to refrain from traveling to China and for those in China to get in touch with the Russian embassy. A number of affected countries have started evacuating its citizens from Wuhan City. In Japan, at least 3 evacuees tested positive, 2 of whom are not showing any symptoms. Global airlines have also suspended direct flights to China's major cities. Among them are British Airways, Germany's Lufthansa, and Indonesia's Lion Air. Other airlines, such as Cathay Pacific, are allowing their flight attendants to wear face masks and gloves during flights. Meanwhile, a recent study conducted by a Chinese team concludes that the incubation period for the 2019 nCoV virus is 5.2 days on the average. Thus, from the time a person is infected to the time he starts showing symptoms of the disease. The findings echo a previous research by a team in the Netherlands. Following the developments, the World Health Organization will meet again on Thursday, Beijing time, to consider whether the virus constitutes a global health emergency. In the meantime, the organization is praising China's efforts to curb the spread of the virus.
China is doing its best, and that helps. Of course, in addition to that, we call on all member states to also give that kind of attention, both political and technical. And that can help us to prevent the spread of this virus and control it as soon as possible.
Due to the cancellation of flights from China to the Philippines, the number of Chinese tourists in the country has drastically decreased. And because of that, some businesses in famous tourist spots are now feeling the impact. Greg Gregorio with the details.
Travel agencies in the country are now feeling the pinch of the coronavirus scare. In this agency alone, 24 clients have canceled their booked flights to China and Hong Kong. They had to refund the payments.
Sa news and everything else, may danger na pumunta, magkakaroon ka ng infection, magkaroon ka ng flu or whatever.
Airlines are now studying whether or not to cancel flights heading to Hong Kong, Macau, or other parts of mainland China.
We have the preventive measures in place, but for as long as there is no declaration from the World Health Organization, then we will continue with our flights. We are reviewing the situation week on week.
We are looking at, we're monitoring the situation with the WHO and other authorities, and we will see kung ilan na lang ba yung natira na gusto pang lumipad.
Philippine Airlines has 69 flights to different parts of China in a week, while Cebu Pacific has 232 weekly flights bound for China. So far, PAL has canceled chartered flights from Calibo to Nanjing, Guangzhou, and Shanghai as Chinese tour groups have been suspended. AirAsia has direct flights from Calibo to Shanghai and Shenzhen. These airlines assure their China-bound clients can opt for a refund or rebooking without penalty.
They are free to make changes to their travel plans.
But with arrival declining, businesses in Boracay are suffering. These Chinese New Year celebration alone, the volume of Chinese visitors was halved.
Everybody will be affected. The economy will be basically affected.
But the local government of Cignal Island is not taking any chances. It has barred the entry of tourists from mainland China and other Asian countries affected by the virus. The LGU says it's safety over tourism.
Saka pa ba siya kikilos, di ba? Kung andyan na yung problema. So we don't have to wait for a case to be reported.
Resort owners in the island agree with the ban. They said they are already expecting booking cancellations and fewer guest arrivals. It is still unknown until when the ban will be imposed.
Actually, may efekto pero other side, doon na po yung proteksyon sa atong mga tao dere sa namuyo, especially sa atong pamilya.
The City Health Office in Cignal is monitoring 10 Chinese tourists. They arrived in Davao City from mainland China last Tuesday. The Department of Tourism, meanwhile, also fears that a novel coronavirus outbreak could pose a long-time negative effect in the country's tourism industry. For News 5, Greg Gregorio, we are One News.
But even before the confirmation of the first nCoV case, several public and private institutions have already put in place precautions. Thermal scanners are now in place at the pamantasan ng lungsod ng Maynila, and students with symptoms will be referred to the Hospital ng Manila and, if necessary, to the Health Department. The Catholic Bishops' Conference of the Philippines, for its part, advised priests to not put communion hosts directly into the mouths of communicants. The faithful are also advised not to hold the hands of strangers during the Ama Namin. Parish churches are also urged to regularly change the holy water and to install protective cloth on the grills of confession booths. Meanwhile, former Health Secretary and now Iloilo Congresswoman Janet Garin reminds people that regular face masks are not reusable.
The mask cannot actually be used 24/7. Kasi iba gagamitin, itatago sa bulsa, gagamitin ulit,